Our moderator for this session will be Kitty McKay. We also have Senator Robin Titus. We have Ron Elges, the Deputy Undersheriff for Douglas County. And from Carson Valley Health, we have Erin Dudley. From Carson Tahoe Hospital, we have Michelle Miller. And I want to give, for our moderator, I want to give her a little introduction. And I have to say, from a personal note, last summer when my father passed, Kitty helped a lot. So Kitty McKay is Carson Tahoe Health Administrator of Community and Patient Experience and longtime resident of Douglas County. For nearly 15 years, she has served her community within healthcare, dedicated to fostering human connection, hope, and healing. And in her free time, she's also co-owner with her husband and her music industry husband, he has quite a resume himself, of the Nashville Social Club. And if you haven't been there, it's fantastic, the entertainment's great, and I recommend the pork chop. So before settling in northern Nevada 30 years ago, Kitty earned her professional chops living in Japan while working in the global fashion industry as an American woman fluent in Japanese. I think, though, she's going to use English today. Is that correct?
Hi, Eigo only.
What she said. After losing her second child, followed shortly thereafter by the sudden death of her first husband, she found the courage to rebuild an inspired life. She now shares the tools that brought her back to wholeness as a nationally acclaimed transformational storyteller, TED Talk speaker, and author of 2 books. So join me in welcoming our moderator, Kitty.
Thank you. Thank you all so much. So, does anybody know what happens at the end of October? Nevada Day, right? And Nevada Day, what we all think of as Nevadans is home means Nevada. And I have to say, from the moment I've walked in this room, and I've done what Bobby asked us to do, to look left and to look right, I'm overcome with the warmth of knowing home means Nevada and heart means Douglas County. We are amazing. When you hear the people who are committed to educating our kids, and you look at these lifetime achievers and the people that had the vision to build this conference room or conference center, we're amazing. And we know that when we realize there's a need, we rise to the occasion. And so our great hope today is that we can build awareness about a challenge that we face in our community that you might not have really known about. You've read about it. You might know somebody that's been struggling with some mental health challenges, but you might not really know what's happening for us. These are our neighbors. This is us that's struggling. We have here today law enforcement. They're going to help us understand what it means to protect our community and also protect our community members that are struggling with mental health. That's a really big challenge. We have Senator Titus here, who not only understands what's going on at the state level and what the state's doing, she's a practicing medical doctor. We have Erin here, Erin Dudley. She's the manager of behavioral health services at Carson Valley Health. Trust me, things have changed. It's really challenging to work with our folks that are struggling. And we have Michelle Miller, who's our Chief Human Resources Officer at Carson Tahoe Health. And especially after COVID and the impact it made on our caregivers, she has some tools that she's going to share with all of us as employers and community members so that we realize we have some tools. But first of all, what we're hoping to do is to create some awareness. So I'm just curious, back in the day, 15 years ago when I started at Carson Tahoe Health, I've had the honor of working with our cancer center and the number of people that were struggling with cancer. And I'd be in a room like this and I'd say, okay, if you've been impacted by cancer, please raise your hand. Either you or a family member or your neighbor. And if we were to do that, every hand would go up. Today, what I'd like to ask, and I bet every hand will go up, have you somehow been impacted by mental health challenges? Either your friends or your coworker, or the kid you're trying to teach in school, or this person you know that's in a crisis but is a great human, they just need help. I can guarantee you every one of our hands would go up. I'll tell you, mine goes up. My son, who was in middle school and then high school, struggled mightily in Douglas County schools, and he had resources there to help him, but I got both my hands and probably both my legs up there. So it's just important that we understand. I see all these heads shaken, the magnitude of the problem we're facing. We had trouble before COVID. Holy moly, guys. It's a lot. And so one of the ways, could we get there we go. One of the ways we can really understand how we're doing is that we do a community health needs assessment. We, as a healthcare organization that's nonprofit, is required to do a community health needs assessment every 3 years. So here's something I'm almost positive no one will raise their hand about. Who loves the IRS? Oh my gosh, there's a winner. You get an extra piece of toffee. But you are the only one here. Who thinks the IRS has really great ideas that they impose on the citizenry? Like virtually zero, except for this one thing I think is really smart of them. They say if you are a nonprofit community-based hospital, every 3 years you got to talk to all your community, find out what they need, and then serve those needs. So in 2022, we wrapped our community health needs assessment. We had 8 agencies. It was Quad County. We had 46 stakeholder interviews. We had focus groups. We had online interviews. We called people. And what that meant in Douglas County is we not only worked with Partnership Douglas County and the Parks and Rec, but all these voices were also there. So this is Quad County snapshot, but it's also very specifically Douglas County. And guess what? All over, we found the same things. What rose to the top like never before is people are desperate for access to mental health services. Does this surprise anyone? No. It shouldn't, because we kind of peripherally know that. But in a minute, we're going to better understand what that means. We also know that people need access in general to health care. Like there's a lot of specialty providers that we can't access, or sometimes it takes a long time to get in for care. And then also, we found out that people using their voices were saying, gosh, we need more healthy and connected communities. And I'm sure since the survey window was through COVID and right thereafter, I mean, the sense of isolation that people are feeling is real. And I don't think that we have regained. I think, if anything, we're finding that the fiber is unraveling even more. We're going to talk about the pediatric needs of our kids. I mean, we need outpatient care, and then on top of that, the kids that need to be inpatient, some of them have to go to other states. We're talking Douglas County kids that desperately need help, and we don't have the services in our region to provide for them. People are delaying their care. This is what we learned from the health needs assessment. People need connection. I don't know if any of you heard this, but one of the most astounding things to me is loneliness. Have you seen this study? There are multiple studies now that loneliness increases your risk of prematurely passing away by 26%. Let that sink in. That is really amazing. And what that means, it's more dangerous than smoking 15 cigarettes a day. So one thing when you leave today, think about your neighbors that maybe his wife died, or somebody you work with that doesn't have family in the area. That's immediately something we can do, is be more intentional about connecting, because it could save somebody's life. We also know that mental health services for youth and adults is the greatest need we have in all of Northern Nevada, and absolutely in Douglas County too. So we need to increase the number of providers, broaden access to outpatient services. We need to increase access to crisis care. Our sheriffs can tell you better than anybody. A lot of the times people are in a crisis, they need care, they need treatment. They don't need to go to jail because they can't get better there. But we need options for that. And you know, when we talk about providing affordable housing for our workforces, for our teachers, it's a big old problem. But when I look at this room, I know that together we can solve this. This last one, community education for mental health, that I think is our biggest goal here today as a panel, is to destigmatize it. We don't judge people when they get cancer. We make them casseroles. As a community, we need to get to that same point with mental health. Whether it's me, my mental health, or my coworker, these are health challenges. So for the last 5 years, Nevada has ranked last in the nation for children's mental health because of the prevalence of illness and the lack of access to care. And then concurrently, the Department of Justice said, hey, you guys, it is not okay that your kids that are suffering are going into inpatient care. As a state, we have to provide more outpatient care. So these are really real challenges we're dealing with. And what we know is that each of us is part of the solution. And this is why I'm so excited to begin introducing our panel, because they all have fabulous bios. But before you hear any of that, if you look at each one of them, what you should know is they serve here at the crossroads of someone's most difficult time in life. And they do that because they have a calling. It is not easy to serve in healthcare. It is not easy to serve in the legislature. I mean, come on, that's like super gold star. It is not easy to be a law enforcement officer for all the reasons we know. And yet each one of them has an internal calling because they're committed to us as a community. So I have the great honor to start by introducing Erin Dudley. For those of you who don't know, she's the manager of behavioral health services at Carson Valley Health, and she's going to talk to us about what's happening on the front lines. Thank you.
Thank you, Kitty. So like she said, my name is Erin Dudley. I am the manager of both of our behavioral health programs at Carson Valley Health. I started at Carson Valley Health as an intern, actually, when I was doing my master's in social work, and I've been an employee there for 4 years now. I started as a case manager and worked my way up to manager. I've actually been there since the inception of our behavioral health outpatient program. So that is 4 years old now, and we are finally really getting running and getting to the growth that we've always been looking forward to. So I'm really thankful to be here today and able to give you guys some information about what we do in our clinic, some demographics of the population that we've been serving in 2023 so far, and then some of the challenges that we're facing both in our behavioral health clinics and in the hospital as a whole as it relates to behavioral health. So I will start off with just an overview of those services that we provide through our 2 behavioral health programs. So we have a general outpatient behavioral health program, and that has psychiatry and advanced practice providers who do our medication management. So that's anything from medication for depression or anxiety to medications for ADHD, sleep issues, anything like that. So they're able to provide any kind of psychiatric medication that's needed for patients. We also have what's called medication-assisted treatment, which is usually a drug called Suboxone, and that is a treatment for opioid addiction, and that goes hand in hand with some substance abuse therapy as a recovery and prevention in relapse model to help treat opioid addiction. So that is an offering from kind of both sides of our medication management and therapy. We also have general outpatient therapy services that have a wide array of different approaches that we can use. We currently have 4 full-time therapists and 1 part-time therapist on staff in our outpatient program. We are fully staffed at the moment, but that is one of the bigger challenges that I will get into in a little bit. We do have some case management that we can do for in-house patients that already are in our clinic, and then we do have minimal crisis counseling available within our outpatient system as well. The other program that we operate is called Vitality for Life. That is an intensive outpatient program for seniors, 65 and older, and that is where those patients are coming typically 4 days a week. They do 3 group therapy sessions a day, and that's also tied in with individual sessions, medication management, case management, and a nursing education piece. It's really important, especially for that older population, to look at things like fall risks, especially when you're looking at medications that they may be taking, substance abuse in that population. And just as people get older and have health issues that go along with that, how do we tie that in with their mental health and make sure we're addressing the whole person and every problem that they might be facing? In the hospital, we obviously also see patients in our emergency department, in our inpatient unit, in our ICU, and all of our primary care clinics and specialty clinics do get some behavioral health patients. We share a lot of patients with our primary care doctors, and they come to us for multiple services, but just because someone has a behavioral health problem doesn't mean that they're only at our behavioral health programs. So we're seeing them hospital-wide as well. So I'll go into just some demographics of our outpatient program only, and this is for January through July of this year. And this is looking at 760 unique patients for the year, and kind of what we're seeing on the outpatient side of things for both medication and therapy. So when we look at age of our patients, you can see that the highest number of patients we're seeing are age 26 to 35 and age 56 to 65. And when you look at our population in Douglas County, that kind of makes a lot of sense. We do have some services for youth, and like Kitty was talking about, that's a huge need in our community. And we have had a really hard time finding staff who are certified, trained, and able to provide those services to our youth. So that's one of the areas that we have struggled most in providing services, is having the people who are able to provide services to people who are 18 and younger. And looking at, our Douglas County population, that age group is declining a little bit, but their problems are not. So we do need to make sure that we are finding the staff and providing the training and the opportunities to the current staff that we have to make sure that that's an area that we're looking to address in the coming years, is how do we bolster those services that we can offer to the youth as well. Race, also when you look at Douglas County, this really is not as surprising. Primarily we are seeing Caucasian patients, though you can see there's an array of other races that are represented in our practice, and then we have some people who just decided not to report for one reason or another, but we can see that primarily we are seeing Caucasian patients, and we're not having a lot of diversity in our programs. Sex of the patients, we are seeing primarily females, but we know that that's kind of a trend in healthcare or not in healthcare, but in behavioral health. So again, not a surprising statistic. And when we look at this, we say, okay, we have, more females than males. What do we do to make sure that we have the staff and the training and the competency to treat the females that we have? But how do we also market to the males in the community to make sure they know they have a place with us and that we have services to provide to them as well? So looking at both sides of how do we treat what we know we have and how do we market to the people that we want to capture and want to make sure have services as well. When you look at primary insurance coverage for our patients, we are primarily seeing Medicaid, Medicare patients. Then there's kind of a wide array of commercial plans that we see, and we have very few self-pay patients or patients without insurance. We do have financial assistance options and sliding fee scales for the patients who don't have that, so they still have access to services through us. But you can see we kind of have an array of places that we are accepting payment from when it comes to behavioral health services and contracted providers that we can use to provide services for a lot of insurance companies. That is one of the biggest selling points of our clinic in the community is people want their insurance to pay for it or need their insurance to pay for their services, so they will wait for our services so that they can go through their insurance. And I will get into kind of some of the issues that causes for us a little bit later as well. Lastly, on the outpatient side of things, when you look at primary diagnosis from what we're seeing this year, this is only looking at the first diagnosis that someone is given, so there's high probability that a lot of these people also have subsequent diagnoses as well. But in terms of the primary thing they're being treated for, it's mostly depression and anxiety, which is very common nationwide as well. And then we also have fairly high rates of ADHD. That is a lot more in our medication management side of things, because we're providing medication for that kind of disorder, more so than we're providing the therapy, and the depression and anxiety is both meds and therapy. But you can see there's all kinds of different disorders on there that we are working with, and again, a lot of these people also have secondary diagnosis in substance abuse or insomnia or whatever it may be. A lot of people have dual diagnosis in depression and anxiety. So this is just a look at kind of what we're primarily treating people for in our outpatient setting. Now I will go into the demographics for the Vitality for Life program. So this is our senior program, and this program is a very small, limited program. So we only have 22 people who have been in the program for the year. It sounds like very few people, but when you know more of the structure of the program, it's actually very normal for us to have 22 people in that program. Because this is a Medicare-based program, it's pretty much everyone 65 and older. We've had some outliers who are a little bit younger who are on medical disability, or we've been able to do single case agreements with their insurance to get the program covered. But you can see we're seeing majority of people who are 65 and older, centralizing more on the 80-ish range. And we've had the oldest we have right now is actually a 95-year-old patient, and you would not know it from looking at her. She's very, very vibrant. So she's the oldest that we've had this year, and the youngest you can see is 60. When you look at race in the Vitality program, again, not surprising, we're seeing primarily Caucasian patients, which goes along with our demographics for this county. Again, more female patients than male patients, not surprising as well. And primary diagnosis is mostly depression in these folks, and then some adjustment disorders, which is essentially they've had some kind of major life event and they're having trouble adjusting, using their coping skills, and getting back to a prior level of functioning. So some of the challenges that we're seeing as a result of the patients that we have and the staffing that we have and the program that we have is staffing is definitely our biggest challenge. So in the state of Nevada and nationwide, there is a shortage of qualified licensed mental health professionals that are able to come in and work in a setting like a hospital clinic. So we hire licensed clinical social workers, marriage and family therapists, clinical professional counselors, and we have not been fully staffed in the 4 years that I have been there until last month. So it's been a huge issue for us. We have worked with national recruiting firms, and we have done our own internal recruiting. We've done a lot of different things to try to mitigate the issues that we're facing from this, but there are just not enough professionals in the state of Nevada or nationwide to be able to address the number of patients that we have. Cost of living is a huge issue that goes into this. I can give one example is we had a therapist who was looking to relocate from Michigan She sold her house in Michigan for $135,000 and came here and couldn't even afford the down payment on a house from the profit of her home sale in Michigan. So we just don't have the comparable rates that people are seeing in other places for them to be able to afford to come here from other places. And we don't have the cost of living that allows for the younger generation who is just coming out of high school or college to be able to afford to live here so that we can grow them into our program either. And the last thing that has really affected our staffing is our telehealth opportunities. So because COVID had telehealth waivers that allowed people to provide services from anywhere, we had a lot of people who started working from home and then decided, I don't want to go back to a clinic. I don't want to have to be in an office 5 days a week. And they don't want to have to be working in a hospital setting, working out of their home, or seeing patients face to face. So that's been one of our biggest challenges, as well as getting people out of those telehealth job avenues and getting them back into our clinics and back into full-time office work. When you also look at wait lists and patient loads, part of that is not being fully staffed, but a part of it is also we have far more people who need help in our community than we could ever have staff to provide for. We have our therapists see anywhere from 30 to 40 people on a caseload, and we have had at times a 6 to 9 month wait for therapy services to get people in, and it's just not enough. When you have a mental health crisis and someone says, well, you'll have to wait 6 to 9 months and see if you're still in crisis, then it just doesn't work that way for mental health. So that is a big issue that we are working to address, but that comes back to our staffing issues and being able to recruit those licensed, qualified professionals to provide the services that we have and need. A lack of inpatient services has been another challenge that we've been facing, especially during COVID. We had to send kids to Texas, Utah, Kansas, places like that when they needed inpatient services during COVID. It has improved somewhat, but we are still really lacking any inpatient services, especially for our youth in Douglas County. And then the other side of that is adults, where we have a lot more resources, but we still have a lot of barriers in place to actually getting people into those inpatient beds. And getting them out of our ER, for example, which I'll touch on in just a minute. Medication shortages is another huge challenge that we're facing. So many of you may know that right now and over the last couple months there's been shortage of ADHD medication, and that creates a lot of challenges for our staff, our patients, our community. Patients are calling us upset that they can't get their medications because of X, Y, and Z reasons, and there's really nothing that we can do for them besides provide a different medication, but that's not always effective. It doesn't make patients happy, and it creates gaps in care when they aren't able to continue on the medication that they need in order to be able to stay at their job all day or stay in school all day, things like that. Prior authorizations for medications and services is also a huge barrier for us. We spend probably about 25 to 30% of our staff time doing prior authorizations for our services and prior authorizations for our medications. So that's just getting people the ability to pick up their medications from the store, come into their therapy appointments, and while that's absolutely a part of all healthcare and a part of all of our services, there's a lot of barriers in place when it comes to behavioral health and how do we have to kind of justify the need for a patient to be able to come see their therapist or come get their medication for their ADHD and those kinds of things. The last challenge that we're seeing on the behavioral health outpatient side is groups. We have tried to kind of open up the avenues that we're able to provide services to people and say, we can't get 50 people in for individual services when we're short-staffed, but maybe we can get some people in for group therapy and see more people at one time. We have tried to start multiple groups in the community and really just haven't had the interest or the buy-in from the community to actually get those up and running, get those functioning in the manner that we had hoped to be able to see more people and get more people the help that they need. So we are doing a kind of interest survey at the moment to try to gather more information from the community and what they would actually like to see from us. But that is one of the challenges, and we are aware of the differences in treatment that come with groups and individual, but we're just trying to reach as many people as we can and not have these gaps in services that are 6 to 9 months. And so hoping to get more information that might actually give us some groups that the community's interested in using. And then lastly for me, some challenges from the hospital setting outside of our behavioral health clinic is also staffing and turnover. When you look at patients that come into our ER or our inpatient unit and are having behavioral health crisis, our staff are not necessarily trained or certified in dealing with mental health crisis. You know, you might have some psych nurses who work at other places who've had experience with it, but you might have a nurse who's never seen a person who's having a psychotic break and they don't know what to do. And so we can certainly offer some training and competency for people, but with the turnover that we might be seeing in some of the clinics or some of our ER staff and people who work in 3 different hospitals in the area, it's a lot harder for us to be able to provide any kind of competency that we can establish for those nurses or doctors or whoever it might be. But that's where our outpatient services can come in and be able to help. When we have patients who are in the ER on a legal hold, we don't have inpatient services for them. They basically sit in our ER for 3 days until their hold expires or until it gets extended. And we are able to at least bring in our therapists or bring in our medication management providers and see them while they're in our ER. It's certainly not the level of inpatient care that they need, but we're at least getting them some behavioral health services while they're there. But staffing to be able to kind of maintain a nursing staff or a doctor staff that has high level behavioral health competency is just not something that we're seeing at the moment. Lack of inpatient services, again, is a different challenge on the hospital side because, like I said, when we get those patients who are on a legal hold, they're sitting in our ER for 3 days. And not only does that take away from ER services that we could be providing to other people, but it's really and truly, more importantly, not the setting for that person to be when they're in a mental health crisis and needing inpatient crisis care. So being able to transfer those patients out to actual inpatient care is one of the biggest barriers that we've seen in the last couple years. Community resources is a challenge in some ways because I think, obviously, I work deeply involved with all of our behavioral health, community providers and other areas, but none of our, ER nurses or people like that do. And so we do as much internal communication as we can to say, here's the resources that we have available, here's how you get connected to them, but we don't necessarily have behavioral health specialists within the ER. Or within our inpatient unit to be able to connect those resources. We do have case managers who do a fantastic job at making sure that they are as up to date as possible, but we could use more collaboration and more information sharing from our community resources. And that might help prevent some of the overutilization of our ER as well, is if we had other places to go or if our staff knew of other places to go for those services, we might not have those patients coming into our ER. And lastly is grievances and complaints, and we're not receiving more grievances and complaints. We have a patient advocate who handles any grievances or complaints that come through our hospital. And what she has seen, particularly since COVID, is we have had a significant increase in people who are making complaints that are delusional, not based in reality, and really and truly centralized in behavioral health challenges and behavioral health disorders that are untreated. And she has worked very closely with our behavioral health staff to kind of figure out how does she address those. Our ultimate goal in any grievance or complaint is to make sure, we remediate the situation. We want the patients to be happy. We want them to come back for our services. But when those complaints are not based in reality, it's very, very hard for us to be able to come to any kind of conclusion with the patient that they're happy with. One example I can give of this is a patient who had, in whatever experience he had in the inpatient unit, somehow thought that we had fiber optic cables running through the hospital that were mind controlling him and our staff, and as a result that the government had access to everything that we were doing, saying, thinking, treating him, all of it. And he was very unhappy that we, as a hospital, did not address this when he was in the hospital and things like that. So in a situation like that, there's very little that we can do to be able to rationalize with a patient who's not grounded in reality. And those have been the hardest complaints for our patient advocate to be able to address at this point. We've seen a huge increase in those. I don't have a lot of information as to why those have been increasing, but we're working to kind of figure out how do we adjust our processes within that grievance or complaint process to deal with the influx of patients who we're getting delusional, persecutory, irrational grievances or complaints from. And that's it for behavioral health.
Thank you so much, Erin. And now Senator Titus is going to share with us what the state is working on.
Great. Well, thank you. First of all, I want to thank you all for inviting me to here today, and I'm learning a lot. And if you see me walking around with pen and a piece of paper, I'm a copious note taker, seeing how I can do better with my job representing all of you. And so I have notes on my program. I have notes up here. The key is, as a doctor, I can't read my notes later on when it dries. So I'll be depending on all of you to reach out to me on things that we could do better here. Just a little bit about myself. I said earlier that I live over in Smith Valley, and my family's been in Nevada since the 1870s, and in Smith Valley in particular since the 1880s. And my mom used to tell the story, and some of you have heard me say this before, about Lake Tahoe and how near and dear it is to our hearts as a family, that my mom and my grandparents, they had 4 kids, and they'd come to Tahoe in the summertime to enjoy Lake Tahoe, and they had a Model A pickup truck that they could not get over Kingsbury Grade, and so at the top of Kingsbury Grade, my grandfather would stop the truck, flip it around, and back up and over the Kingsbury Grade. The kids would hop back in, and they'd come and enjoy Lake Tahoe. I happen to have a 1931 Model A pickup truck in my garage that runs beautifully in Smith Valley. I haven't tried bringing it up and over Kingsbury Grade, though. So I am Senator Dr. Robin Titus, and I had the honor of following James Settlemeyer, your previous senator. I will never be able to fill his boots, but I will hopefully bring some energy and passion as he did so well. But my district is so different than what Senator Settlemeyer's district was. When he represented you folks here at Lake Tahoe, which he's always represented, and very well, he represented Douglas County, Lyon County, Churchill County, and Story County. I represent, with a lot of gerrymandering and redistricting, all of Douglas County, all of Lyon County, all of Churchill County, all of Mineral County, all of Esmeralda County, and I think I said Lyon, and then Esmeralda, and I represent Tonopah. And if you don't think the needs of what South Lake Tahoe needs, and the needs of what Dyer, Nevada needs with the lithium mines, man, I was thrown into a lot of issues. And Senator Settlemeyer, I reached out to him and said, you didn't tell me about the issues between the South Lake Tahoe folks and Carson Valley folks. Should have given me a warning here. So I'm catching up fast, and that's why I was so honored to be on this panel. I think hearing our last presenter, when we talk about mental health, we all get depressed, right? Because what can we do about it? What do we do about it? We, as Kitty mentioned early on, all of us have been touched, whether it's personally, somebody you know, not only just COVID, but depression, loneliness, suicide, opioid abuse. Our sheriff, Undersheriff will speak to some of these issues that face Douglas County in particular, and the uniqueness about Douglas County. But the state of Nevada, you're not alone in that way. The state of Nevada recognized about 3 sessions ago, we really needed to get a grip on mental health issues in Nevada. And they split us up into different quadrants. And so we developed these, there was initially 4 quadrants of behavioral health boards, and 1 legislature went on there, and we were charged with coming up with what's unique in our district. I'm on the Northern Nevada Behavioral Mental Health Board, the Rural Behavior Mental Health Board, and some of the members are sitting here today to what's unique about Douglas County, what's unique about this area to fix some of these behavioral health needs. The state of Nevada this last session put forward 25 different legislative acts regarding mental health. Now the good news is I'm not going to increase your depression by going all over 25 bills. That's another topic altogether. Yeah, but I will go over some that really do affect you. There were 2 bills that came out from the session that fortunately were not passed that directly attacked Douglas County, in particular over your sirens, and then some of the school board choices. But those weren't about really mental health bills. And so the mental health bills were really more of a statewide issues. And so we put together a couple of those about what we've done. And one of the things we recognize, and you can see, I don't want to just read it to you, that what we actually have to, has already been mentioned, we need to be able to have more accessibility to mental health needs. That's a huge thing. It actually hasn't really gotten much better during COVID. It only got worse, and it hasn't recovered. Over 20% of adults have some sort of mental health disorder, and 5% of the disorders really affect their quality of life. Our system ranks at the bottom of the rankings when it comes to helping mental health. And I don't know about all of you, but I'm so tired of Nevada being in the 50th percentile and all the bad rankings, and we really need to make a difference on that. So happy to talk more about that, the issues, but as we've already heard, we don't have enough of us mental health providers in general out there. So that's one of the things that we have to do. There's about one mental health professional for every 460 residents in the state of Nevada. So what we're trying to do is fix that, so you're not alone out there. And it is something that we have recognized. So we talked about a whole bunch of things on mental health, pupils in the school district, and that was Senate Bill 72. It talks about looking at different topics that we need to do in the interim and how to actually help mental health. And again, I'm going to go through these pretty quick. Happy to any of you reach out to me if you want some more details on that. And then we have to report back. We did talk about telehealth. One of the things that we passed, Senate Bill 119, actually you can get reimbursed for telehealth services. And since there's not enough of us and the mental health providers want to stay home, at least they can get reimbursed for that. And that's something that we're going to go through since COVID. So to make sure you can get, even if it's just telehealth, better than no health at all. The next one is 237. What that does is it has a crisis call line 988. Now, I'm somewhat frustrated with that. We had 211, we have 911, and then we came up with 988. 988 really is important, and when you have your employees there, hopefully you can address on that employee handout you get in when you interview for a job, et cetera, that if they're in crisis, they can dial 988 and they will get referred to some services. We're trying to keep people out of your squad cars. We're trying to keep people from dialing 911. And so it's one of these national programs that wherever you are in the United States, you dial 988 and you're going to get referred to the appropriate help. They also, part of that bill, pays for some mental health services. So I think that's really something that we have to do. The other thing to affect, again, our law enforcement is here, as you all well know, too many folks fill up our jails that are there because they have a mental health issue. And so we're trying to fix some of that, not just with men, but also women recognize some of those issues that women in particular have. And women are kind of we don't really address women, incarcerated women's health needs, let alone their mental health needs. So we're trying to fix that. Something I think that's really going to be important is Assembly Bill 389. And so what they're looking for is, again, incarceration of youth, get into Medicaid waivers so that once you get into jail, you actually have a health care pathway afterwards. The worst thing that can happen is release these folks out into the streets. We've medicated them, got them under control, and they can't get in to see a doctor for a month, so they don't have the medication. What do? They commit a crime to get back into jail so they can get their treatment. The other thing is Assembly Bill 37. We heard about workforce development here, not just for mental health providers, but there's a dearth of workers in our state. It's not just flipping burgers at Burger King, but it's your bankers. The Wells Fargo one in Douglas County, one of your branches had to close, or in Carson had to close because they didn't have enough bankers. It's across the board. So everybody here is in business and trying to find somebody to show up. You can find them maybe to show up the first day, but having them show up the second day, let alone show up on time, it's a huge issue. We need to get folks help when they need it, and so AB 37 actually looked at a workforce development center for Nevada, especially for mental health. We also established more funding for the nursing pipeline, trying to grow your own. I'm a product of my county. I grew up in Smith Valley, small little school. Wanted to get out of Smith Valley. Of course, I went back and lived there, but that was my goal. I got a scholarship in chemical engineering. I was the first woman in chemical engineering at UNR. But then rapidly saw when I went to an interview in my junior year to go to Dow Chemical Corporation in California, and I thought, shit, I don't want to work here. I want to live in Smith Valley. So I came back and changed my major to medicine because Dr. Mary Fulston, who had delivered my mother, was in her 80s, and I thought, oh, hell, I could do that. And so I actually lost my scholarship, but then how was I going to pay for my med school? And so being able to pay for your education is huge. My county, Lyon County, paid my way through medical school, so I'd go back and practice there. I owed them 3 years. Well, I've been there since 1984. And so I think it was a win-win, right? But I'm also, in rural Nevada, if you show up, right, you get appointed a lot of things. I'm the county health officer. I have been for, I don't know, probably 40 years almost. I'm the long-term care medical director at the little hospital in Yerington. And then obviously I'm in the Senate. I gave up active office practice a couple years ago. One of your homegrown boys, Caleb Orko, came and took over from my practice so that I could go back. So thank you, Douglas County. I owe you the ability to stand here before you today because of a Douglas County native. So thank you very much for that.
So Senator Titus, I was just going to say, if you were going to globally say, what can we expect from the state or addressing all this? Because
Right.
we are.
All right, so as a politician, I can speak a long, long time, and so we're going to move through this. The key is money. The key is finances. The key is opening slots for education. And so here's where the rubber meets the road, right here. Money. And so we got a lot of money from COVID. We got a lot of money afterwards. Look at the general funding for what we're putting into behavioral health funding. There is an improvement in that. Grand total of mental health funding from the year 2020 fiscal year is $219 million, and we're going to go up to $301 million for 25. So the key is money to fund these programs, to fund the education, opening slots. Me, it would be also really important to allow for. I don't want to go that direction. I don't want to steal. I don't want to steal your thunder. The key is important is education, educating our students, keeping our students here in Nevada, letting reciprocity for nursing, getting our professionals here, making it easy for people to come to Nevada. We want to be welcoming. And hopefully this group can get some handle on the cost of living and some of those things. I'm a free market person, but the key is bringing more professionals here. Thank you.
Thank you so much. And as you've said repeatedly, you're so available to questions and all like that. And now we have the great honor. The great honor of anybody who knows him, Undersheriff Ron Elges, Douglas County.
I've been here since 1993. I apologize for the sheriff not being here. He is out of town. He's a very charismatic, very good speaker. I am not. I'm the thing that lives under the bridge, and that's what I do. My captains refer to what I do as living in the pressure cooker because that's what I do. But he is apologetic. I thank the Business Council for letting us be here and talk a little bit about this today. As you can see, I'm not very small, so I'm hungry, so we'll get going, I promise. We're going to go over some mental health stuff that's really important, but I want to bifurcate out real fast and give a shout out to the school district. I was kind of sitting there thinking about this. I know the sheriff is a Douglas High grad, and this is my span of control, so this is not anybody else. Everybody from everywhere is great, and people in this community are phenomenal. Captain Britton is a Douglas High grad. Ron Vegetarian is a Whitell graduate. I'm a Whitell graduate. I believe our district attorney is a Douglas graduate. Our county manager is a Douglas graduate. Sometimes statistics don't really show you what happens in this world, right, and what really is going on. They can say whatever they want, but these are some of the best people I've ever worked with, so they're good. Not to leave out Captain Coons. He went to Smith Valley. He's second string, okay? And Stanley we stole from the Marine Corps. I don't even know if he went to high school. All right. Going on, so I have some statistics for you real fast. These are our coroner cases. I'm going to show you, probably it's hard to see, but I'm just going to talk about them, but they're just up there for you. Legal 2000s are when the sheriff's office goes and contacts somebody who we believe is in a mental health crisis. If I fall, it's going to be hilarious. If you're in a mental health crisis, that they are not going to go with the program, so then we create the paperwork and take them to the mental health provider, the doctors, and get them against their will. Okay, so this is 2023 right now. We're already at 143 calls for service for mental health issues. Okay, we've had six suicides to this point, and the big thing I want you to look at is the legal 2000s. We're at 26. Okay, so I kind of pulled some stats real fast about every year. In 2022, we had 48. I have the paper in front of me. 48 legal 2000s, which means we took 48 people into custody and took them to the behavioral health areas, the hospitals, to make sure that they were taken care of because they didn't want to go. And in those statistics, thank you, sir, 175 calls for service for mental health. Okay, so that was in 2022. In 2020 is the next slide. It was a little bit higher. We had 187 calls for mental health. Could have been to COVID. We don't really know. But we are seeing, what you'll see is there was only 11 legal 2000s, meaning we only contacted 11 people as opposed to 2022, we contacted 48 and took them against their will. And then in 2018, same thing, low contact of the legal 2000s, but the calls for service are about the same, and we're still looking at between 11 and 15 suicides within the county. So what has happened, and what the sheriff and I discussed, is we've started forming these groups like a MOST team and a FAST team that's in the jail that helps, and working with our healthcare providers to try to get in front of the mental health itself. Let me go forward. So we have the mobile outreach safety team, which is a deputy, usually with a clinician, and they go out and we have calls when the deputies get a call for service and they say, hey, my mom or my dad or whoever it is not feeling really good, or they're talking suicidal stuff. They go out and we try to get them to interact with them first. Then we start creating paperwork and paper trails to start looking at how do we get them some more help. So we're trying to get in front of it because obviously after they committed suicide, that's really not helping anybody. We can help the family that's still left behind, but we're not helping the person. So these teams, like we're trying to work there, and I apologize, I'm not very good with the PowerPoint. You can see I can get it all messed up. And working obviously with the fire department and everybody else that's in this realm in the hospitals to try to make, we get a hold and get to contact these people because it is very important to get in front of it, not stand behind it, which has kind of been prior, like in 2018, we weren't really in front of it. We've kind of now moved in front. We're saying, hey, let's get in front and start talking. And I'm going to show you a video because I get to, and it's fun. But you're going to see what we're dealing with now. And I apologize. I know it's a very serious subject, but I just can't be serious all the time. But you're going to see what we're dealing with now is a total different type of mentality that's happened. And I'm not a doctor like the senator or anybody else, but it has changed, whether it's COVID, whatever happened and changed society, being stuck inside, I'm not really sure. Oh, where'd the thing go? Oh, there we go. So the other thing we're doing, the first thing up there is Moxie Up, and I know they're talking about juveniles. Moxie Up and Thrive in our community, nobody knows. They deal with juvenile suicides. Before, if I went to your home and I said, hey, what's going on? You're 15-year-olds, I'm going to kill myself. And we'd be like, okay, well, here's a card, call these people, you guys sit around the house and figure it out, because we had no other services. Places like Thrive and Moxie Up now are taking on that responsibility and trying to interact with these kids in crisis, again, in front of what's happening and not dealing with it when it's already there. The school district is part of this. Our SROs are part of this. We're trying to talk to these kids now. What's causing this? And we all can probably guess, right? Some of it's probably the internet. I mean, I can't imagine somebody with a phone when I was in middle school taking pictures of me and then posting it somewhere, and how terrible that would be how I'd feel horrible, me running around. Rick's got, give me that wedgie thing, and my underwear's around my noodle, and they got photographs of it, and everybody's posting it. I mean, can you imagine it happening to you? It'd be horrible. So the school's dealing with a whole different side of this that I think is tremendous, that they're going to have to try to figure out, and they're doing a good job of trying to get in front with these kids. And of course, Douglas County Suicide Prevention, we try to work with them, with the families, with the partnership, and all the other stakeholders that Katie had up there. We're trying, whether it doesn't matter you're in California, it doesn't matter you're in Lyon County, it doesn't matter anything. It's people dealing with people, and that's what we're really trying to do, is reach out the best we can. And we're trying to make sure that that word gets out, that people know, look, if I'm having a problem, just call us. A deputy will come talk to you until we get somebody that really knows more to help you out. So we're really trying to get that message out. And through that is a crisis intervention team. This is a training that every deputy goes through. It's a 40-hour class. It teaches them how to talk to people with mental health problems. The law states, because it used to be when I started, and I don't even know about Wes because it was so long ago, but when we started, you dealt with everybody the same, right? Some guy comes at me, he's crazy, yelling at me, I tase him, beat him, stick him in the cell. That's not the way it works anymore. The law says you can't do that. You've got to talk to them, know there's something going on with this person, try to work with them and understand that you're going to have a different reaction out of a person who's maybe autistic or maybe somebody who is on the spectrum. We developed a thing called the autistic program where all our autistic kids in the county, they're in our computer system, in our CAD, so a deputy's going to a call, and all of a sudden it pulls up, oh, Billy's autistic. He doesn't like lights and sirens, so maybe we'll show up a little differently. Excuse me. Or maybe he doesn't like this, and we'll be able to respond a little differently so we can talk to him and not excite him and then get into a fight. So, pardon me, so we're trying those little different things. One of our biggest problems, sorry, excuse me, is, like they were alluded to earlier, is housing. When we talk to somebody who's having a crisis and they start becoming violent, and we use violence to subdue them, there's criminal charges. With that puts them in a cell. The duration of that cell time in there is not helping their mental health. It's deteriorating it even worse, and now we got to put them back in society, and now we're dealing with them again. It's a vicious cycle. So we're trying with our FAST teams, these other teams, excuse me, to try to find these shorter terms to get them to mental health facilities faster. It is a problem. It is, they talked about it. There's not the facilities, there's not the money. We're going to have to start making changes to make this happen. So what we're seeing is I apologize for my cough, mental health versus mental health drug-induced now. We're seeing a lot of people that have just done too much narcotics or illegal illicit drugs, and they're just having mental health issues, whether it's opioid crisis, fentanyl now, whatever it is. My Captain Britton was very, very acknowledged in fentanyl. He talks about it with people because it's just becoming a bigger crisis. People can't get their fentanyl, they're losing their noodles. So we've got to find ways to try to help these people more and more, and there is some programs coming along with how to do that. If you want to show the video, so what this was is up here at Lake Tahoe. Debbie's got a call. A lady said my boyfriend's freaking out. He's destroying the car. She pulled over on Highway 50 between Lake Village, and she was trying to, she didn't know what to do with him. He's just freaking out. So you'll see. I want you to listen to how the deputies are speaking to him, which is much different than the days when I started.
Donald. Sheriff's office, calm down. Calm down. Donald, calm down. Sheriff's office, buddy. Okay, Sheriff's office, calm down. Donald. 103's in the front passenger. She's going completely 1080. Donald, calm down for me, all right, bud? Sheriff's office. Donald, can you talk to me? Sheriff's office. Okay, Donald, nobody wants to hurt you. I need you to talk to me, all right, bud? Hey, Donald, deep breaths for me, okay?
Now it's time to die!
Hey, calm down. Okay. Donald.
You die now, bitch!
Donald, I need you to calm down.
That's when you're dead.
The point of the video, though, is I want you to see how our deputies are responding. They're learning how to handle this differently. Okay, in the olden days, it could have been just grab him, pull him out of the car, and put him in handcuffs and drag him off to jail. Let him sit there until he calms down. We don't know what's wrong with him, but we're trying to find better ways to deal with people and to help them is the idea. So that just kind of gave you an idea of what we're kind of seeing now. That's more of a drug-induced probably mental health issue. That's not probably mental health itself. He just lost his noodle. Whether he overdosed on something, we don't know. But he did that. So that's kind of where the sheriff's office is coming from. Again, we're trying to get in front of this. We're trying to make sure that we can help people now and not have to deal with it when it gets to this point. So that's really I guess we'll have questions after that.
Thank you so much.
Yeah, thank you.
Thank you. So now we have Michelle Miller, who is a chief executive at Carson Tahoe over HR, and it's really similar to what you're saying, is that we're all reframing how we look at this, and this is us, and it's not from stigma and judgment anymore. It's like trying to understand and coming from that perspective.
Absolutely. Thank you so much to being here on the panel and being here with you today. I'm Michelle Miller. I have my PhD in industrial and organizational psychology. Gives me a little bit of a different lens when coming into HR. I wanted to be able to close this panel with sharing some tools with you, whether you're an employee, an employer, a teacher, a coach. These are going to be some tools for you to work through the mental health crisis that we're living through, and being able to shift the workplaces that we have or are engaged in. We've done a lot of changes. Employees are remote now. We're centralizing things. So we've strategically taken the human out of HR. I want to give you some tools on how to put that into it through each and every one of your roles in the community. So I've got 3 reminders for you. First and foremost, putting your people first, because if you're not able to do that with the people that are your neighbors and around you, it makes it nearly impossible for them to be able to serve others. Everyone's a VIP. And I don't mean that in the traditional sense of everyone's a very important person. We are, but we're very individualized people. And as we talked about, every single person is going through something that you may not know about. People's family members are passing. We're dealing with all these struggles in school. One of my employees was just sharing with me that her daughter's first day of high school, she was so excited to go see her friends, and her friends ganged up on her and beat her up. And then she's having to live through that over and over again on social media. And there's so many things that if we don't connect with our people, I may have never known that she was going through that. So it's important for you to be true neighbors and truly caring and compassionate for the people around you and being cognizant of what's going on in their personal lives. Part of that means being present in every moment. So I'm not scanning the room. If you're on a cell phone, that means you're not present right now. And I say that to be mindful if you're talking with someone, you're having a conversation with them, or you're in a meeting, if you're on your cell phone, or you're answering an email, you are not present in that moment and taking in what they have to share with you. And lastly, that means you're listening to learn and not to reply. So you need to be understanding what they're sharing with you, and you could just be 100% listening, and that could be all that person needs in the moment. They don't need you to provide a solution to them. They just need to be heard. Keep in mind work-life balance. I know I'm standing in between you and lunch, so I'm going to keep this short.
That's balance.
That is good balance, right? So for work, there's a lot of things to think about as an employer and an employee when it comes to schedules, the bandwidth of the workload, and again, meetings. If you've got a lot of meetings in your workplace, maybe something to think about decreasing some of that time, because then that pulls into they don't have enough time or bandwidth to get the actual work done, and then you have longer days, more stress, and it's going to start bleeding into each other with personal and work life. And again, in their personal lives, there may be major life events, family members passing, health issues, cancer, and I want to be able to provide you, like HR is usually really black and white. I want to let you know that there is a lot of gray. Be mindful. There's so much change in the world. There's so much that they're going through. School's so hard. You talked about absenteeism and all these problems that we had. Trauma, and we're triggered as humans, especially around the holidays. Kids are sick, family stuff's going on. You know, we've got all these crazy dynamics. I know we have policies and procedures that we abide by for attendance, but I think it's important to be mindful, especially if you know your people and you know they have life events that they're working through, that may bleed into the holidays and them needing a little bit more time off to be able to come back and be whole as a person when they come back to work. Toolkit, I'm not going to take a lot of time to talk through all of these topics. As employers, I'm sure you have some resources for your employees, employee assistance program. We've, thanks to our community, are able to offer the CALM application to our employees as healthcare workers, because we have behavioral health team members who are serving our community and our employees but then don't have someone to take care of them. So we wanted to be able to do that. So I'm now going to encourage you to do what I've seen a few people do already and pull out your phone. Go ahead and take a screenshot of this, because this is something that if you don't already have it in place at your workplace, you'll be able to provide it to people that are in need. And again, encouraging 988 and all of these other incredible resources that we have in the community that have been funded, that are underutilized, to be able to keep these people out of our emergency rooms. I wanted to share that it's important to keep the door open. So while these people may be coming and sharing things with you from a very personal perspective, that conversation is not a singular event. You need to be able to reconnect with them. Keep that thing in mind. Go check in on them. They may, on the outside, be cool as a cucumber and have a really hard candy shell, but they're still a human on the inside, and sometimes they just need someone to say, hey, are you okay? How are you doing? And then I wanted to encourage some positive psychology, so I wanted to tap into my IO background just a touch. So there's 3 ways to be able to break that stigma. And I think back to, behavioral conditioning and Skinner and, all the great psychology past, but there's 3 really basic ways that we can encourage this more, because there is unfortunately a stigma attached with mental health and talking about it. So this can help us normalize. The first would be natural reinforcement. And that's just the simple fact of when you're talking with someone who needs help, in that moment, they have that instant gratification of knowing that help is actually there. The second piece would be social reinforcement, and that's when you're closing out that conversation with someone, to thank them for being brave enough to come forward and share something with you. Because that will encourage them that it's okay to do it, and it's okay to do it again. And if they need help, to be able to proactively go get that help with maybe some of those resources that you've shared. And lastly, it becomes tangible reinforcement. So someone who's received help will naturally and organically start to want to help others, because that's a part of their own healing and the journey moving forward. And that's all I have.
Yes,
So,
thank you.
Thank you.
Thank you. So everybody's starving, and it sounds like it's really good food, but please know that everyone here is so delighted to field any questions you have, ideas that you might have, and know that there are so many earnest, hardworking, dedicated folks that are committed to making this better for Douglas County, for our kids, and for our adults, so that our kids don't grow up to be these adults that are also struggling. So thank you so much for your time, and thank you for being such cool Douglas County-ites.